So by that, I'm assuming there are no questions. Things are going very well. That's good to know.
There are no questions in the chat, Doctor.
Go ahead. No questions, Dr. Sohaib, you mentioned? Okay.
Yes.
So I will start. I'm sorry.
My apologies, Doctor. There are no questions in the chat.
No questions. Thank you, sir. Thank you, sir. All right. Yeah, no problem. Okay. So today I will continue this week and next week. Usually the last few weeks, we discuss or start actually the discussion about the epidemiology. This, if you are listening to the news and all the meetings and decisions being made about coronavirus and the vaccines and all of this stuff, you hear that there is a special category of scientists that are most responsible now for most of the decisions. Those are epidemiologists. And the field of epidemiology is an extremely important field for public health and for medicine. So we need to know the basics of epidemiology, because most of the time the physicians, you guys, are in charge of a public health system or a ministry or a municipality, and then you need to know the basics of epidemiology. Today I have 3 lectures. This lecture, which is Introduction to Basic Concepts, and then I have this lecture, which is the Principle of Epidemiology. This is really a slide, a presentation from the Center for Disease Control and Prevention, CDC, the United States CDC, because we have now Saudi CDC. So this is the United States CDC, which is actually the most important entity in the United States when it comes to combating or fighting against COVID. So they prepared a course, a very short course or presentation as an introduction to epidemiology. So I wanted to give you my version and their version, so you can see that the knowledge that you'll have is international. We don't want to have certain amount of information, and I want to expose you to different levels of epidemiology. So this lecture is self-explanatory. It's on Moodle. You find it on Moodle. The 3 lectures are on Moodle. This lecture, and then the last one, which is this one. This lecture. So those are the 3 lectures that are already on Moodle. So I am going to explain as much as I can. I've written those lectures to be self-explanatory. You don't need me with the lecture. You can read it better than I can. I'll try to explain as much as I can. You still have next week and then tomorrow and next week to ask question. Next week will be a review. We will finish epidemiology. I will have a review. So it's really the next week are the, you don't have a regular lecture. It's all, I will, designate that lecture to explain certain questions, certain ideas. And I can explain some of the ideas in these 3 lectures if you want me, but I think you will find them very easy to understand and they make sense, okay? So let me go back to my presentation. Okay, just give me a minute. Okay. Okay, so now it's this one. All right. Do you see it now, Dr. Sohaib?
Yes, doctor. You can see it.
Oh, all right, it's clear. So this is a very brief, very simple introduction to epidemiology. In this course, I want you to know the basics of biostatistics and the basics of epidemiology. Remember, we're just scratching the surface. We have not even started the 2 topics, but at least you have an introduction. You know what they mean, and you know how significant those fields and topics are for your field of medicine, especially when you are doing research in medicine. So the basic concept, the terminology, this is to show you where the term epidemiology comes from. So this is for your interest, And then I like to have some definitions for epidemiology, and this is one of the definitions of epidemiology, and this is the source. It really helped to know at least one definition for epidemiology. So that's the definition of epidemiology. Now, I also wanted to define intervention. Now, how many of you knows the definition of intervention? Remember, you are using intervention in almost every day's language in medicine. Whether you say you are intervening or you are applying an intervention. What is the definition of intervention? You need to know the basic definition of these. So intervention cover a wide range of activities from drug treatment, So I really would like you to know these definitions. You don't need me with that. This is really self-explanatory. Intervention can include individual patients or a population. You can have an intervention for one patient. You can have a CT scan, and you can have an immunity program, vaccination program for the community. This is an intervention in one patient, which really is the job of a physician. And the other one is an intervention in a community, which is the job of epidemiologists and public health practitioners. And then, how many times you've used the word hypothesis? Do you know how to define it? I want you to know the difference between hypothesis and study. For example, somebody would say, this is a study objective. And what is the difference between study objective and hypothesis? Or study question? Of course, this is an advanced knowledge for 3rd year, but I want you at least to know the definition of a hypothesis. Remember, in biostatistics, Dr. Peter talks about hypothesis and taught you how to, take a hypothesis and test it. Okay, so these are 2 different definitions of a hypothesis also for your. Now, If you know epidemiology, if you know public health, you have to know these three things. You must know them by heart. What is an endemic, epidemic, and pandemic? Okay, you need to know. So if you look at this graph, the endemic is any disease in the community. If you go to now to the community of Riyadh, you find certain diseases are, most people have it. Diabetes, let's say diabetes, 20% of the population. We call this as an endemic, meaning the disease exists in a rate that is usual for that population. If suddenly the rate of people with diabetes jumped from 20% to 40%. So you say, wait a minute, that's not the usual existence, the usual prevalence of the disease. It's exceptional. So what is endemic? It's the usual occurrence of a disease. Okay. Now, if the occurrence became above normal, then it will become an epidemic, and that's where the name epidemiology comes from. Okay. Now, if and this outbreak, we call it sometimes outbreak. Remember, COVID-19 was outbreak before March, I think March 11 of this year. Before that, it was an outbreak. On that day, on March 11, I think, or 13, the WHO announced that now the COVID-19 is a pandemic, which is the third one here, pandemic, which means the disease is now spreading worldwide. So these are the difference between three terms. If you read them one time, I don't think you will ever make any, mix them up. Very clear: endemic, epidemic, and pandemic.
Sir?
Now, yes, I'm so happy if you stop. Yes.
Just a question. So the outbreak is the not pandemic?
I'm sorry. The outbreak is. Yeah. Now, the outbreak is not a pandemic. Some people they use the outbreak as another name for pandemic. The outbreak usually is a epidemic or outbreak, and that's why when you read the literature, they tell you that the COVID-19 outbreak has become pandemic. So the only word that's used for spreading throughout the world is pandemic. Okay. And that's where you get the panorama and Pan-American and all this pan, meaning across continents. Okay, so pandemic is the epidemic that it crosses the continent, crosses the boundaries of all continents. Okay, so thank you for the question. But look, who cares about terminology? I want you to learn one thing for this course. If I say outbreak, it mean an epidemic. Pandemic is a one name, and endemic is one name. The outbreak is only epidemic. Now, some other people might use it differently, but in my course, I'm going to use it this way, and the exam will reflect this knowledge. Okay? Thank you for the question. So how can we apply epidemiology? You can read these in the application. I mean, for example, to make the proper diagnosis and prescribe appropriate treatment for a patient, this is for a clinician job. Okay. Now, a clinician job requires knowledge, experience, clinical judgment, and understanding of the patient, and scientific information comes from the literature. So the decision that you make as a physician, you need a lot of information coming from different sources. However, the epidemiologist uses the same sources of information. However, not to examine a patient, but to examine a community. So remember sampling? I told you there is sometimes the unit of sampling is one individual, sometimes is the community. So when the community is the unit, then any intervention applied to this community is that's what we call it. It's a job of an epidemiologist. The epidemiologist applies intervention into the community or in the community or throughout the community. Okay. And then another application now, again, this is another explanation. For every idea, I have different explanations, so you don't get one side. So whatever you like, you can use it, but the meaning is the same. Now, let's take this simple, when a patient with diarrheal disease, if we have a patient with that disease, the clinician and the epidemiologist are interested in accurately diagnosing the patient, both of them. However, while the clinician usually focuses on treating and caring for the individual, so the physician wants to know why this individual has this diarrhea. The epidemiologist focuses on identifying the exposure. The epidemiologist wants to know why this patient has diarrhea. Is it because of food? Is it food-borne? Is it airborne? Is it what is the source? Is it really because of a disease, another circumstance? Sometimes our mental health, if somebody is under stress, they may get diarrhea. So we need to identify the source of that, and that's the job of the epidemiologist. Okay, so the epidemiologist, they don't want to treat the disease, they want to know the source and then potential for further spread. So they want to stop it. They want to stop the spread of that disease. Okay, and that's why now they are creating a vaccine to really control the COVID-19 and prevent the spread to other people. Okay, any questions? In general, I want you, in the epidemiology, they talk about natural disasters. Those are like pandemic or hurricane or dust storm, reappearance of diseases. So all of those, you really need to be interested. Why? Because those events affect groups. They don't only affect individuals, they affect group of individuals. That's why the epidemiologist wants to know, for example, after the dust storm, in this dust storm particularly, it affects my health, and I start having sensitivity and start then coughing and stuff. So really, it's not me. It's a lot of people like me who have sensitive lungs were affected with that. Now, if I want to examine myself, I would go to a physician, tell them, give me some medication for that. But if I want to, if we want to make sure that the community is not affected by it, the epidemiologist and the public health official now need to sit down and say, in case of a dust storm, what should we do? How can we protect the group? That's why they did in COVID-19. How should we protect the population? They said, well, social distancing, use a mask, even though a lot of people resisted that. So they have this algorithms, paradigms to, if you follow it, it can protect you until you have the vaccine, then nothing replaces the vaccine. Okay? Now, part of epidemiology is prevention. As I said, the epidemiologists look for the source of the disease and try to stop it. Why? So that you can prevent the spread of COVID from one person to another person. That's why you need social distancing. They studied that if a person is talking, they might, with the saliva or coughing, the virus might go from one person to another person. Actually, they studied all of these particles and how fast it goes through the air. It's a medical physics, actually. So they studied that and determined that you have to have 6 feet or 2 meters or whatever. So those are for prevention. Now, the people who are specialized in prevention divided in 3 types of prevention: primary prevention, secondary prevention, and tertiary prevention. Primary prevention is before things happen. What can we do to prevent, to help people not be affected by another dust storm? For example, we can actually tell them to get a mask. I used to wear mask anytime we have a dust storm. So that's meaning before the event. The event what is dust storm or COVID-19 or any other disease. Secondary one, during. What do you do during, while the dust storm is happening. They tell you to run to a closed place and cover your mouth and cover your nose. So you can do things during that event. So that we call it secondary prevention. Tertiary prevention, post. What do you do after that? After that, definitely you have to go and if you feel the symptoms, you have to go and examine yourself. Okay. For example, after surgery, there is something called rehabilitation. It's a field of medicine. Rehabilitation, they call it rehab in the United States and England. Rehab. So this is really what to do after the surgery. The event is surgery. How do you help the patient to recover? Is by getting them into a rehab center. Okay. So those are 3 types of prevention. Is that okay? Is that clear? And here I'm giving you examples and everything. So see, not only I give you the definition, but I give you examples. And so it's really in detail that you really feel that you have enough information. Okay. Now, immunity to a disease. Now, the immunity to the disease can be self-immunity and can be community immunity. So people find community immunity is very difficult to pronounce. So they say, okay, forget about community. We'll call it herd. Herd in English is that they use herd for a qatiya in Arabic, or it's a herd of cattle, a group of cattle. It's usually used for a group of cattle or group of sheep or group of giraffes. They call it herd, which are a group of animals herding together or walking or running together. So they use that term for, instead of saying community immunity, they said herd immunity, meaning group immunity. I can have immunity against the coronavirus. Let's say I got it and now I have the immunity or I have the vaccine. This is, we call it individual immunity, but community immunity, it happens when enough people in the community get the vaccine. That's why when they told you to get the flu shot, they're asking you, if enough people get the flu shot, the disease cannot be transmitted. So if you're in your family, you have a flu shot, then you cannot transmit the disease and the disease cannot infect you. So you stop that spread of a disease. And they say that you have, but people say, what is the percentage? How many people in the community, and what's the percentage of people who are immune that can stop the spread of the disease? Most people say 80 to 90, 80%. You cannot say, oh, I'm going to give vaccine to 20% of the population and then get a herd immunity or group immunity. No, you have to reach almost 80% to get that herd immunity. And you can read about it.
Doctor?
Yes.
So if the population, maybe 80% of the population get infected by this virus or this disease, and most of them get recovered, can we say that this is a herd immunity also?
Yeah, absolutely. But guess what? Let me tell you what's going to happen in this scenario. Actually, the British health system, they recommended this. And the whole world was upside down, inside out. They really, rejected that idea because they told the British health system, if you want to wait until 80% of the population infected, it means that 5% or 10% of them will die. So are you planning to kill 10% of the population? Do you know, if you have, let's say the Saudi Arabia, the population is 35 million. What is 10% of that? 3.5 million. Do you want to kill 3.5 million people to reach that immunity? Some people say, oh yeah, well, let's do it because this is the only way to do it. That's why there was a huge interaction, huge discussion in the scientific epidemiologic medical community. What do we do? Shall we do the social distancing and shall we do the mask to stop the spread, or shall we do nothing and let the virus travel freely and reach the herd immunity, meaning infect 80%. So those who are survive, they will be they have immunity and whoever dies, dies. No, that's mass murder. Some people say this is a mass murder. You cannot do that, okay? So the alternative is to do the preventive measure and spread the disease mechanically by wearing, then do it biologically by getting a vaccine, okay? So once you get a vaccine...
Absolutely, this is the correct way.
I'm sorry?
I said absolutely we should stay away from each other, and this way is better.
Yeah, but if you go back, please go back and read about early on in the COVID-19 and look, read about the British health system and see what they were saying. Some of them until this moment still say that you are wrong, you should do the herd immunity paradigm, meaning let it free, don't close anything. I mean, they have some legitimate reasons. One of the legitimate reasons is if you don't kill people with the vaccine, you kill them with depression. If they sit at home, they'll have anxiety, they'll have depression, they commit suicide, they'll have divorces, and that will happen. The divorce rate, astronomically increased. It's skyrocketing. The suicidal rate also increased, but not as many as 3.5 million died from herd immunity. I mean, so you have to compromise in this case, and that's why the epidemiologists help you. As a physician, you don't have training in that. The epidemiologists have training, and they can consult with you and tell you how to make a balance between people dying and closing the society. You cannot just close the society. Anyway, it's a long discussion, but very, very interesting discussion. And you as a physician are in the middle of it, in the middle. Now, physicians in the United States now, they are complaining, they are saying, they are begging, they said, all of us have been in the OR since March of this year, and we cannot leave the OR. If we leave, people die. So please don't, because people on the outside, they want to go to the bars, they want to go to the cinema, they want to go do this, do that. They have Christmas and Thanksgiving, and they get infected. And where did they go? To the hospital. Who's going to pay the price? The physicians. The first price paid by the physician. That's why they will be the first one to be vaccinated now. The first group to be vaccinated are the medical staff. So they are now crying. They say, please stop this, stop the madness. We need to get some rest. Otherwise, they will really be they will leave the profession. And I know a lot of people left the medical profession during that period. They say, we cannot take it anymore, especially nurses. So it's really a huge discussion, and I really would like you to form an opinion and validate your opinion with evidence. And that's why evidence-based medicine is a good thing to have. How do you form an opinion and stick with it? Okay. Now, how it works, again, that's, we talked about it. I think you read it, you'll enjoy it. Now, I need an answer. Do you know what is the population of the Kingdom of Saudi Arabia? Now, you guys are living in the kingdom and getting education in the kingdom, and the majority of you are citizens of the kingdom. Do you know what's the population of the kingdom? Who can give me a guess, a good guess?
40 million.
34.
How much? 34. Great. One fantastic guess. I'll stop right there. It's 34, 981. Now, this is a few days ago. So if you go to this website, it will give you it's always increasing. Like this 510, 511, 512. It is really it's increasing by the second. So, but we can say around 34, 35, around 35 million. So if you get a question like that in the exam, please don't say 25 million or 15 million. It's 35 million. That's in the neighborhood of 35 million. Okay? These are my references. That's the first lecture. I was very fast, but I guess you are used to me being fast. Any questions? Okay, good. No question. I'm going to move to the second presentation then. That's fantastic. I'm so happy that you guys are So now, we had some basic epidemiology. Now, I want to get to the tools of epidemiology. What the epidemiologists use, what do they use to, to conduct their research? There is a language, there are tools. And remember, in biostatistics, we talked about means, variances, and all of this, and talked about probability and talked about ratios and stuff. And so we really now want to talk about the basics of that field. I want you to know the basics. This lecture you must know, not because of the final exam, because you are a physician. You must know this, and you should not make an error with that. Okay, so let's go very quickly. And all this information are old information. All of it you know from high school, from 7th grade, 8th grade, all of it known to you. Now, these are new definitions, demographic and vital statistic. I want you to know the difference. When you do a study, you collect demographic for your patient, for the population, or for the group that you're studying. If you go around the class and you are doing a study, like, remember the study that I sent you the survey for? And by the way, thank you. I really appreciate all the efforts. We have, as Dr. Suhaib knows, we have reached the sample size. If you still want to fill it, I would really appreciate it. But the evidence that we'll get from this study will be representative. Remember, representative sample, because the sample is large enough to represent you. For example, if I took a sample and all of these samples turned out to be males, or the majority male or the majority female, the answer is not representative. It represents one group. But what we know now that the answer really is a good answer, and we will share with you the answer to the question that we talked about. So these are demographic. When you get, sample size, gender, race, those all are demographic. However, there are other terms, we call them vital statistics. Those vital statistics describe the life of the population, meaning birth, death, marriages. So all of those, you cannot have a dead population and they have birth. Dead are dead. You have to be alive to have birth. So that's what we call it. We describe the life of the population. Birth rate, marriage rate, death rate, so disease, the disease rate. So all of those we call it vital statistic. So the difference that, remember, demographics only gender, race, doesn't talk about, I'm sorry to say that, if a dead person, you can say, oh, this dead person has a gender, and this is a gender, this is the race. So you can describe using demographics dead people, but you cannot use vital statistics. I had to go to the extreme to explain it, but all right, okay. So the rest you can read actually. Vital statistic also, please read it. These are more examples and explanations. Practice exercise. Now, this is a practice exercise that I have for you here. We're saying, for example, you might want to compare the number of deaths. Remember, death is vital statistics. Number of deaths in the United States in 1991 and 1992. Look at these two numbers. These are, we call it raw number. The raw number are the actual number you collect. For example, they counted how many births in the United States in 1991, 2,169,518. That's the whole United States. In 1991, 2,175,613, which means in 1991, we have more births, so the number is increasing, okay? So we call this raw number. Now, if this is birth, that will be, but in this case now, it is death. So death or birth are vital statistic. In this example, let me go to the example now and say it one more time. In 1991, 2 million died in the United States, guys, 2 million, etc. In 1992, 2,175,000. So in this case, we have more death in the United States, since the example is death, more death in 1992. Why do you think there are more deaths in 1992 versus 1991?
War?
I'm sorry?
Maybe there was war.
Okay, that's good. Another reason.
And new diseases, maybe.
Okay. Well, do you know what a good example? What if this is 2019, 2019, 2020? You see what happened in 2020? We have COVID. So you'll see the death rate is much, much, much higher than 2019. Okay. Now, so remember what we said right now, that now what about that now do you think in 1992 the population of the United States is more or less than 1991? More, because now the next year the population of Saudi Arabia will be more than this year. So can this be only due to the increase in population size? We have more people die. You see, so the point here, when you use raw number, you may not be able to detect the right answer. So raw numbers are very misleading. That's why in epidemiology, they don't use raw numbers. They don't use raw numbers. In statistics, they used it. They analyzed it. But in epidemiology, no. They said they are not the best thing to use to describe the life of the population. Okay? So let's go back to the practice exercise. And then, so again, this is a saying, how would you observe how you interpret the observed increase between 1991 and 1998? And this is the same thing that we say. It is the same thing. Now, remember that example, I'll get back to it later on. I have definitions. How many of you knows all of these definitions without looking? You can tell me what's the difference between count, ratio, proportion, rate, and risk. Even though all of them are simple, but when you look at them, I want you to memorize it. Of course, understand it. Memorize it because you will need it every time you do a presentation in medicine. Anytime you do a presentation in medicine or research, you're either using count, ratio, proportion or percent, or rate, or risk. Risk, remember, what did I call risk? Probability. The risk is probability. So those things, I want you to know the definition. You need to know them. And I've given you for each term a question about it. So please remember those. And all of those terms we are using in epidemiology to measure disease burden. What is the burden of this disease? For example, measuring the burden of coronavirus on the Saudi population. So we'll find out the risk of that. We find out the proportion. What is the proportion of people with, if you look at the data that the Ministry of Health publishes, you'll see using exactly the same terms. So please remember those terms, okay? Now, after that, I have given you in the next few slides definition and example, so you do not miss it. It will make a lot of sense to you. If not, I can give you more example and explain it more and more and more, okay? So those are, now, rate versus proportion. This is really confusing. What is considered rate and what is considered proportion? I want you to know that also. Okay, praxis, this is example too, so you can really review the concept, and this is also rate, I want you to know it. Now, again, one of the most important rate is the mortality rate of a population, okay? Mortality rate, so the mortality rate, usually we describe it in terms of number per 100,000 or 1 million or 10,000, okay? That's how we describe it, because the rate, so we have some reference number, okay? So now, if we go back to the previous example, the death rate in 1991 was 860.3 per, so we have 860 per 100,000. Each 100,000, 860 died in 1991. Look at 1992, 852 per 100,000. So even though the crude numbers was more in 1992, remember that it was, look at this is number, this is higher than this. 2,175,000 higher than 2,169,000, but the rate was less in 1992. So these are misleading. That's why we use only rate and all of these terms. We don't use the raw data. So because what happened in that, if you go back and read about it in 1992, as one of our colleagues said, there was more outbreaks in the United States and more people died. So that's why we find more death per 100,000 than in 1991, okay? So although a large number of population people died, the death rate decreased in 1992. So raw numbers are very misleading, don't use them. That's the bottom line. Now, infant mortality rate is the most important number about any population. If you want to decide if your population is healthy, you find the infant mortality rate. Because if the population has a good health system, they take care of the pregnancies, they take care of the birth, and they take care of the kids, which are the most vulnerable creatures. So they survive the birth time or the birth operation, whatever, whether it's a natural birth or surgical birth. So now this is a table that shows you that these are the nation, and those are infant IMR, meaning infant mortality rate, IMR. So how many per 100,000? In Argentina, 22 per 1,000. So 22 infant mortality per 1,000 live births. So you have every 1,000 births, 22 dies. Which country is the best country in terms of this? They have the best health system. You see that Sweden, United Kingdom, United States, Canada, and which countries are the worst? Look at Ethiopia. And you can tell now, when a country like Sweden has 6, they have a very good, an excellent health system versus Ethiopia when they get a lot of help with their system. So now we start talking about rates and tables and death rates and as I told you, those are you have to distinguish between demographic and the other types. So all of those have to be remembered now. And if you start using it, it will get familiar. The first time it's always odd, like remember the odds ratio, how odd it used to be. But once you repeat it once, twice, it will be something that, so we have something called crude rate and specific rate. So I want you to also know the difference between crude rate and specific rates. So in this table, it has some crude rate and have some specific rate. So I'll leave it to you. It's very simple, but I want you to get to know it so that this is an exercise I want you to do. That's an exercise for you to answer this exercise. That's take home. Okay? Questions?
Doctor, there's a question in
All
the
right,
chat.
I have now 10 minutes. Yes, please.
She's asking if you could re-explain the difference between demographics and vital statistics.
I'm sorry, what's the question?
She's asking if you could re-explain the difference between demographics and vital statistics.
Yes, sir. Absolutely. Demographics are terms that we use or variables that we use to collect data about a population. Just any population, like the Saudi population. We collect the gender. We see like that's 55 female, 45 male, or what are different races, or what are the age categories. We know that one of the youngest population in the world is the Saudi population because there is a higher rate of young people more than older people. So that's all of those are demographic. However, vital statistics are the terms that used to describe the life of a population. And remember what I said before. I can describe a dead person or dead animal, and I can say the gender is male or female, even though it's not alive. However, if I want to describe the life of the population, when the population is living, I need to use this vital statistic. What happened when the population is living? There are birth, death, disease. So all of those things, and marriages. So in the population, you have first birth, and then people get married, and then people die. Then in between, you get diseases all the time. So those are vital statistics. So vital statistics are terms that we use to describe the life. So the key word in this case is life. And remember, the difference is those are general, generic terms. Those are, every one of them has to have a living creature. Okay? Was that clear? Yes
I
or
hope
no?
that answers your question, Samiha. Can you say that? She's saying, yes, thank you, doctor.
All right, great. Any other question, Dr. Sohaib?
Yes, there's one more question.
Okay.
This is by Hania. The question is, can you give an example of a ratio? How is it different than proportion?
Look, this is really, let me go back. This is a proportion, this is a ratio. The ratio is, this is the definition of a ratio. A value obtained simply by dividing one quantity. I'm sorry.
Are you sharing the screen?
Oh, I'm sorry. It's not, okay, I'm sorry. Oh, no, I'm sorry. Let me go back. That's when you have several, okay, let me go back and sorry about this. Okay, all right. Did I get it right now?
Yes, doctor, we can see the screen.
Thank you. Sorry about this. Okay, this graph, this slide will help you in comparing between ratio, proportion, rate, and risk. So let's take the definition of a ratio. What is a ratio? The ratio is a value obtained simply, the value of the ratio is, it's dividing two entities. So first, the denominator, this is, the x is the numerator, the y is the denominator. The denominator has no time attached to it. Numerator, so those may not be related. X and y should not be related. For example, 5 injured women and 15 injured men. What is the ratio? 5 divided by 15. 5 and 15, they are not related. 1 man, 1 woman, or 1 to 3. That's what we call it a ratio. So it is used for gender, race, and all of that. So that's a ratio. Let's go to the, you need the rate, is that right? The rate is the number of cases of a particular outcome of interest occur over given period divided by the size of the population. So this is really, the rate is when you have, the only thing that differentiates rate from other things is the time. Now, remember when you talk about your car, you said, my car, I drive 50 kilometers per hour. What is the 50? 50 is a rate because you are driving 50 kilometers per hour. So when you say per hour, it's a rate. It's a rate. And also, so anytime you put time attached to it, it becomes a rate. So now, if you don't have time like this, no time attached, not time frame, it becomes a ratio. So ratio, take any two numbers and divide them by themselves. The rate, no, there is a time and one number related to the other number. Okay? Look, it takes a little bit, I'm sorry, it takes a little bit of practice because I told you new terms are not easily comprehended. Yes, I'm sorry.
Sorry, doctor. The question was if you could get an example of a ratio and how it is different from proportion.
Look, this is proportion. It is a type of ratio when the numerator is part of the denominator. It's written there. That's exactly answer your question. So the proportion is a type of ratio where the numerator is part of the numerator part of the denominator. And this is the example now, down there. Okay? Is that clear? All what you need to do is to read the definition and apply one or two examples, and then you will know the difference. You will know the difference. Okay?
Yeah. You're saying, okay, thank you.
Any other questions? My pleasure. Any other questions? Okay.
No, doctor,
so now I really may not have time to cover, but I think I'll the last one, let me see if I can open that. I need just 2 minutes of your time. This is a lecture by the CDC. It actually, the principle of epidemiology. This lecture is self-explanatory. Look at the bottom there. It will explain to you in black down there. You see under the slide, it explains to you the whole thing. So here you have a note, here you have explanation. So, and you have learning objectives. And then what is epidemiology? It tells you what epidemiology is, and it gives you the reference, okay? And where did they get that? And then it actually down there, it will explain it to you. So it's very self-explanatory lecture. I want you to read it. And it has questions and answers. Look, see how it's very cute and very, very simple. And it has check your knowledge. It gives you the answer. So it have, and you can bet that some of these questions will show up in the final exam. Or if, you know, I'm not saying 100%, but most of the time I like to bring some of these questions. So please read this lecture. Now, I'm going to leave you right now. I have tomorrow and we have next week. I can explain any slide that you want to. I just want to make sure that if somebody doesn't want to come next week, but don't say that, then they don't have to come because, you know, if you understand all of this, then next week will be a repetition, okay? But if you don't, you're welcome to come. So I want to make sure to finish your curriculum now. So the slides and the presentation that online now, those are the ones that you are responsible for. That's it. You know, so the final exam, which is on the 24th of December, will include all of these lectures that we've covered since we started, including the midterm material. Okay? So I want to leave you because I hate to delay you for the next lecture. Any questions? Now, you can leave. For those who want to ask questions, you can stay behind. Make sure that you're not late for your next lecture, please. So I'll wait if you have any questions.
If you guys have any questions, please unmute or put it in the chat. I will read it out.
All right, then you have a nice weekend, and I'm more than happy to answer any question. Come, tomorrow or next week. Please, any questions, Dr. Sohail?
Yes, there's a question. This is from Sarah. She's asking that she has a question about the first lecture. Rehabilitation after surgery, is that tertiary prevention?
We have a patient what?
Having rehabilitation after surgery, is it considered as tertiary prevention?
Well, what is the purpose of that after surgery? Why do you do it? Now, remember, what is the purpose of rehabilitation? The purpose of rehab is to stop, to prevent the spread of the disease, to make sure that the surgery is healed up very soon. So you're stopping the disease. So if for any activity after the surgery, any activity, the purpose of which is to heal you up very quickly, that's a tertiary prevention. Is that clear?
Doctor, I was the one that asked the question in the chat. I was just confused about when you say in the slide pre-event phase, post-event phase. When you say event, are you talking about the disease?
Exactly. The event, you define the event. What's your name?
Sarah Saleh.
Sarah. شوفي Sarah, listen to me. The event, you define it. I'm going to define the event as COVID-19. Give me the prevention before, during, and after. What is the prevention before COVID-19? Remember, I define the event, COVID-19. Give me a prevention.
Social distance.
Perfect. During?
Getting a test, I think, or going to the hospital.
Exactly. Isolation, exactly. After that?
Again, social distancing to prevent it from happening again.
Yeah. So you see now, you got the idea. Now, you define the event and then find out how do we prevent this disease from spreading? Is that how you decide pre, during, and after? Is that clear?
Yes, thank you.
Great. Thank you for the question, Sarah. I really appreciate it. Any other question, Dr. Sohail?
So, Doctor.
Yes.
This just for diseases what can spread out. It cannot be disease, for example, if the patient has a problem.
It can be anything.
With any organ in his.
Any disease.
It can be anything.
Any disease.
Okay.
I'm sorry. Go ahead.
Go ahead, Doctor.
No, it's okay. We have an echo, so go ahead, please.
So, I mean, if it is like, if the patient has a problem in any organ of his body, so as a we can go to the hospital or learn a patient about his disease and in the problem with event which is the disease. We can do the surgery for the patient, and after if there is a problem with his surgery or anything, we can get the patient back and solve the problem. And what I mean is it can. Okay.
You're absolutely right. So you see, first you said, what is the event? What is the disease? Is it hip fracture? Is it COVID? Is it cancer? What is it? Is it really foot ulcer? Whatever the disease is. This is what my disease. And then you say, what can we do to prevent this from happening? That's pre. So stop it before it happens. The second one, well, it happens. Then you say, how can I limit the effect of the disease? It happened, finished, done. After the disease, how can I make my recovery faster? Okay?
Okay, thank you, Doctor.
My pleasure. I can give you as many examples as you want to, but your example you brought was absolutely smart. Okay, any more questions?
Doctor, one last question. Someone's asking about the CDC lecture. She's asking if you're going to explain it next time, or it's
absolutely. Just ask. Look, all what you have to do is to ask. You say, I can explain whatever you want to. Anything in the curriculum, just tell me, I want this to be explained. I will absolutely. I know some of you may not need explanation, but some of you say, yeah, I like it to be explained. I want an explanation. Yes, I will do that. Absolutely. But please do me a favor, please. Could you please read it before? When you read it, you can ask them good questions so I can answer them rather than, have to explain every little one. And so read it and make sure that what is it that you understand and what is it that you don't understand. Okay?
She's saying thank you.
All right. Any other questions?
I believe that's all, Doctor.
Okay, great. Then inshallah we'll see you tomorrow. Have a good evening. Salam.
Alaikum salam. Thank you, Doctor.